Welcome everybody back to another webinar for Lady Leaders series. And I'm really excited for this one because, well, I'm excited for all of them. But what I will say is it's because I've already taken coaching calls this week that have talked about this, which is, I definitely can start to feel that the economy is slowing down, that people are becoming a little more hesitant in spending discretionary income in dentistry. And so my hope is today we're going to really dissect how to use Supercharge treatment acceptance by doing smarter hygiene exams. And with me, I've got some of my very favorite people all together. So Monica, I'm going to start with you. Just do a little intro for people who don't know you.
Sure. I'm a practicing dentist in Chicago, Illinois. I have 3 associates, 6 hygienists. So this is a very important topic to us that we touch on all the time. I've been with DSI since 2017, and I've been practicing almost 15 years. And this topic really fires me up. It's actually one of my favorite things to talk about. So
Yes. And I lucked out when I asked you that it was. So Monica's also a black belt coach with DSI. She's a dear friend. I always joke about Monica, like what you see is what you get. Like she is the most real human in the world. And so she's an incredible dentist. She is super growth oriented. She does a ton of production out of a very small space, not anymore because she expanded, but she's a wealth of knowledge. So I'm super excited that you are able to join us. And then also I have my incredible lead hygienist in one of my offices, Kylie. Kylie, go ahead and introduce yourself.
Hi, like Doctor said, I am the lead hygienist here in our Avon location, and I have been in the dental field since 2013, but a hygienist since 2016.
Yeah. And she is, I have to always, because she's not going to say it, but she works, I can't take any credit for this. So I don't think it's any ego, but she works 3 days a week and does she makes over 100,000 and still produces over 3 times her pay. Like she's just an incredible producer. She's incredible at talking to patients. She maximizes every appointment. And that's why I was like, she's kind of the perfect person along with Monica to sit and really kind of dissect all of this. I'm just like, I love getting to work with her. She fires me up about this topic. So, so it's really fun to have people that I love talking about it. And then as always, Ashley, everyone knows the GSD queen, but as my co-host, you always bring such a beautiful perspective, especially from team, the fact that you work with a lot of doctors, but anything you'd like to say in the intro?
Hi, guys. Welcome back to another edition of Lady Leaders.
Everybody knows you.
To that point, too, just grateful to have these lovely ladies with us. So we always love when we have guests. So thank you for being here.
Yes, for sure. But like I said, and Monica, I think you can attest, taking a lot of coaching calls, I just have found that this is a topic that's starting to pop up more and more. Besides my schedule getting more bare, I'm starting to find that lower case acceptance is happening, both with new patients and with recalls. So in both areas, the first thing I want to ask is, Monica, what are you seeing in Chicago, in a metro area? What are you seeing with acceptance?
we're seeing that as well. We saw it maybe a couple of months ago. It was starting in our area. And now we're starting to see, unfortunately, a lot of layoffs happening. So we're kind of one of those areas. We have a lot of, big tech companies. Seems like Chicago is kind of a bellwether. Some of the stuff in the bigger metro areas happens first, and then it takes a while to trickle out. So we're seeing that. So we're really kind of focusing on, hey, what can we do today for you? It's going to be the cheapest, easiest things to fix right now. And also kind of holding the patient's hand and walking them down, why it's good to fix and what happens if we don't fix it, right? Without feeling overly sales pitchy and, overly pressuring the people. But we are definitely seeing, people scared to do some stuff.
Yeah.
Yeah.
Oh, absolutely. And I say the same thing where I'm like, I always look to you first to find out what's happening because we're usually a solid 6 months behind you, if even. But it's good to know that you're seeing that because I've talked to people in other metro areas and it's happening there as well.
Yeah.
Kylie, obviously we live in the Vale Valley, which, as Ash knows, like it's rural in a weird sense, but maybe not quite so rural. It's kind of a resort community, obviously. We have a decent population. It's just a little different. But, Kylie, what are you seeing in your chair as far as the slowdown?
A lot of the slowdown is just patients not really making it a priority. I hear it all the time. I ask them about their summer plans. They just got back from Europe, or they have Mexico coming down the pike. And then when it comes to dental treatment, they're really quick to say, "Oh, I can't afford that." And
Oh my God, we have the same patients. It's crazy.
And it just tells me that no, it's not so much finances, it's a priority. And I think that comes down to just the exams and explaining to them truly why is it needed. It's not elective. This is a disease that we need to treat, and here's what happens if we don't. So it just kind of circles back to just that conversation, I think, that we're using to educate our patients. Now, I will say there are the occasional patients who did get laid off or just lost their insurance. And so absolutely always willing to talk with them and come up with different financial parties that we can use to come up with payment plans and things like that.
Yeah. But we're seeing it here. I know we're seeing it in our Eagle office too. And what I would say is, we live in a little bit of an interesting community, to her point, that the discretionary income can either be really, really high or potentially really low. But I think the slowdown has given people maybe more of an excuse to put off treatment and go to Mexico instead. Ashley, what are you hearing maybe in the Denver area or just in general from doctors and people?
I mean, same. I think we probably hear it before you do a little bit, but I respectfully, I'm in my own little bubble out here, basically in Kansas, not Denver. It's almost Kansas. But I think it's about that education, like you mentioned. It's about the like maybe being supportive and not salesy. It's about letting them know, like, hey, that, like, helping them to understand why it's a priority. So I think you touched on that really well. Yeah.
So I think, the first thing that we want to dive into to discuss is, when it comes to treatment planning in the exams, the handoffs, the verbiage, the closure rates, the first thing when I'm talking to people is like, well, what's your current system, or do you even have a system? And the one thing that I tell people is, as you start growing, it's easy when you have one doctor, one hygienist, or one doctor and two hygienists. It can be easy to just have that one doctor kind of run the show. But if you're looking to grow, expand, add more hygienists, add more doctors, it can start to get difficult to have one doctor driving every exam similarly with all different hygienists. And the first thing I invite doctors to look back on is, do you have a standard? And we've talked a lot about the optimal care pillars that I know I created years ago, and we have access to that in a lot of our webinars. And we created that truly years ago to just set the stage for all hygienists, all doctors, like, what are the different areas that we're looking at? But it ends up with those different pillars of health, which are, our soft tissue, hard tissue, occlusion, missing teeth, aesthetics, and airway or sleep. And with that, it kind of lends to, what is our system going to look like for hygienists? And, I'll start with just saying, Kylie, you did work in other offices before as a hygienist. What did it feel like when either you had systems or you didn't? And what ended up, when it came to treatment acceptance and talking to patients and the care, what ended up happening if you didn't have a system?
Yeah, so a couple offices where I didn't. One example was an office where it was just kind of very broad. The doctor didn't really set expectations of what was expected during my assessment or what was going to be discussed during the exams. So when she would come in, it would just tell me what you guys talked about. And earlier in my years of hygiene, of course, my eyes went directly to soft tissue. So that's all I talked about. And then doctor would come in and focus only on hard tissue. So then there was almost like a discrepancy of priorities to the patient. And I think it left them kind of confused of, well, what do I need to focus on? Another office, it was just kind of continuously was very similar in the sense, but then he would come in and say, did you talk about XYZ? And if I didn't, you could tell he almost got frustrated. Like, why didn't you bring this up? But I didn't realize that was expected of me. So then it kind of built this resentment, and it almost like created an internal struggle within the office of, well, what do you want? You're not making it clear. And then why aren't you doing what I want? Just because things weren't set or discussed.
Yeah. So you didn't necessarily even know what he was going to talk about when he came in.
No. Yeah. You kind of just went in there and said, here's what I talked about, but he saw something different. And then he'd be upset that it wasn't, you know, kind of teed up or the patient wasn't aware of it.
Yeah.
Yes, diagnosis by osmosis, right?
Yeah.
I talk to my coaching calls all the time. Well, I thought that if I just went in there and I said that everything, they would know that. I had a call. I'm like, well, have you ever just tried telling them that this is, you know, hey, can you talk about these things? Well, no. I was like, okay, let's start there, right? So that's
Yeah.
it's a huge hurdle.
And speaking of that, like Monica, when you first opened your office, did you start with systems, and maybe because you were part of DSI, or did you have anything? And then what really, like, when did you realize you needed one? At what point?
I didn't really start with any systems. I was a startup and I came from a Medicaid office, and I had never actually even worked with a hygienist before when I opened up my own office. So I had to really learn how to work with the hygienist, because before I did everything, right? So there's only one person in there, and that was me. And that's, you know, the easiest thing to do. But when we added a hygienist in, I saw right off the bat, like, whoa, like you're not diagnosing this SRP. You came from this other office. You would just, okay, like first the soft tissue stuff came glaring to me, because I did think, I was like, okay, hygiene, you know, that's soft tissue. They're the soft tissue police, and I'm going to come in and be hard tissue police, right? But I saw that was a disjointed. So we had to get what is an SRP? We have laminated sheets in every single room, according, you know, to the protocols. This is what we're all diagnosing the same, which is really hard. So that system's in place. And then I feel like constant calibration with hygienists and associates. Okay, I'm saying this is a crown. What are you saying it is? Okay, why? Let's all decide. What are we diagnosing this as, right? And that's part of it has to be a conversation, not just a top down, you know, order. So I think because you guys are the soft tissue people, right? So you're going to tell me sometimes, well, you know, I really don't think that's a 1 to 3. That's really a 4+ because of this and this. And I had to, oh, okay, great. That's great. That's what their protocol is. So I think that's important to have those conversations, like you kind of touched on already.
Yeah. So it's funny because, like, when you started with just the one hygienist, you didn't necessarily even recognize, just going in, doing the exams, she wasn't going to pick up on everything you were going to say for both of you. Like, she wasn't going to figure it out just by hearing what you were saying. And so it's that recognition of them being able to help co-diagnose is really that first step. And call it what you will. I know for some states you can't say co-diagnose. I'm like, call it whatever you want to call it.
Yeah.
You know,
I always like, you're in there for an hour and a half and I come in for 5 minutes and you don't mention anything about that giant cavity up on number 2 over there by the cheek side. That's going to look real whack. Like,
yeah.
So,
yeah.
you know, the patient knows, you know, and I know, you know, so we all want to make sure we're talking about it. Yeah.
Yeah. So I think, like, that's the first step. And, you know, really, it doesn't matter whether there's an economic slowdown or not. Like, this is just good systems to have regardless. And I think, you know, I think what we're all saying is having no system might work when you're really tiny, really small, potentially with one person. But the minute you start adding even one more hygienist, you're adding in a factor of potentially diagnosing different. So I think the first thing is figuring out how to have a system. And I know Ashley's going to include, like, what are optimal pillars, I think, or like the webinar that has that, you know, information of, like, even a good place to start is identifying what's important to you as an office. And then what are the areas you're going to look at? Soft tissue is going to be number 1, but much like Monica said, in that system, you're going to have to think through what are all the parts of the soft tissue that you will look at. And, you know, and that's going to bring us to really, what are our hygiene exam cards look like, or what do we use to calibrate these hygienists? And so, Monica, I'm going to start with you. And if you can kind of break down, what are your hygienists filling out, what's on them, and go ahead and take as much time as you need. Like, what are you expecting for them to do before you walk in?
Yeah, absolutely. I like to keep things super simple. Like, I find that my attention's all over the place. So the more there is on a sheet for me to look at, the more I get lost in it and I don't end up looking at it all, right? So ours is really super simple. Tooth chart up above, patient's name, have I met them? Yes or no? Circled things that we talked about: decay, cracked teeth, bruxism, ortho, just circled really quick. And a special note on the bottom: patient's proactive, patient's reactive.
Yep.
Patients trying to get pregnant, just important things that I need to know, right? I have a quick snapshot of what I'm going to walk into while I'm in placing an implant or drilling a crown. I can see, I can look and say, this exam is going to take me longer, or there's nothing on the sheet. I've met the patient before. It looks good. I know I can be in and out, right? So I already know how long am I going to have to spend in each room. So that's a huge hurdle over. A lot of times, you know, in offices, especially with headsets, doctor, patient's ready in room 3. What are we walking into? Are we walking into a 2-minute exam or a 20-minute exam, right? So that's super important just to know how long it's going to take me right off the bat. If they write reactive, well, I know we're going to have a little bit of a battle on our hands, right? If we write someone super proactive, first time here, was referred, their husband, their kids come here, so we're probably going to have a little bit of an easier exam, right? So that's first off, what am I walking into? And then full FMX, full charting, explanation of what's going on with their gums. You know, IO pictures. I always talk about good tooth, bad tooth, show them something good, show them something bad. You don't have to talk about every tooth, just show them in the areas, you know, I see a little something going on here. This may be a crown, maybe a filling. I'm not really sure. The doctor's going to come in and talk to you about that. But I like my hygienist to be a little bit more aggressive in their treatment planning than me. I like to be the reasonable second opinion, right? So it's nice for them to show them more. And I say, you know, this one's, Allison has great eyes. There's definitely something starting there, but we're going to watch this one really getting here floss. But these two on the other side, we have to treat these because, right? So that's nice. And I don't want them to spend a crazy amount of time on it, but enough so they have a good understanding before I walk in. The gum stuff, that's you guys, you are the gum specialists, right? It's your territory. I always ask before I talk about any of the tooth stuff, do you have any questions about any of the gum stuff? I'm sure Madi did a great job explaining it, but just in case anything was confusing or didn't make sense there, 99.9% of the time it's nope, they explained it really, really well. Great. Let's not beat a dead horse. Let's move along. Right. So I think that's important too, to give them your confidence that they explained it well, and you don't have to re-explain what they're explaining. Trust them that they did it well, and then move on. But let the patient know if they still have questions, we're still able to answer those for them. Yeah.
Okay. So just to make sure too, to just make certain for clarity for anybody listening, your sheets have a few questions up top. Teeth chart, name, did I see them? They have mostly circle things. And then really at the bottom, anything pertinent
yes,
for you to know. And we do the same thing with proactive, reactive, but like just something that like, hey, the person's pregnant, they're going through radiation. They said they have no money.
Cat just died, something like that.
Yeah. Okay. Yeah. That way, you know, going into it, kind of what you're getting, because you can see it before you ever walk in behind. Like you're behind them. You get to see this on like their 12 o'clock cabinet, keyboard, whatever.
It goes in my room before I go into there. So if I'm in doing a treatment, which I usually am, it goes into the room. They slide it in. I know they're ready for me at that point, and I can come in whenever. They're wrapping it up. They're rescheduling the next appointment. They're doing whatever. So I know when that sheet ends my room, it gets okay. Then I can plan my escape too. Hey, you know what? We're going to let you close and relax for a little bit. We're doing a lot today. You got to close your jaw, relax. This is going to be a 2-minute exam, huh? You know, I'm going to let you close for 5 minutes. You know, it lets you just plan your day better. And yeah, the sheet is really simple. It's circled. It's name, you know, what new patient, recare patient. Have I met them before? Yes or no? That's so important to me. I hate when that one's not filled out. I'm like, do I have to go in their ledger? Have I met them? You know, what they talked about. And like any issues on certain teeth, circled. Some of them like to color in where they see the proximal decay. That's fun too. So
yeah, exactly. Yeah. Okay, great. So you just have this sheet that you ensure that every new hygienist is introduced to. It makes certain that they're going to be able to see kind of what, you know, they're going to get to see kind of a map or roadway of what you're going to talk about when you walk in.
Yeah, absolutely. And then especially with new hygienists, I feel like this is really important. We all have that thing where we all need hygienists right now. You hire one, you put them in, and then you expect them to know your system day one, right? Just like I do with my associates, new hygienists, you guys don't touch anyone for a couple of weeks. You guys are hanging out, you're shadowing with my very best people. You guys are doing the systems with them. And then after that, you're doing the systems with someone else watching you. So by the time you are on your own, you know the deal is, right? You know how to fill out that sheet. There isn't any questions, you know, the same thing with how do I post that appointment is complete? I want everyone to look really smart, right? So I feel like sometimes we do that to our team members in general. We just throw them in without much training, and then they're like, oh, I don't know how to do that. And I'm not quite sure. And we never answer that question. That's why they never do it, because we've never closed that knowledge gap for them, essentially. Yeah.
Yeah. Okay. Super helpful. Ashley, yes?
Yeah, we have a question. Is this sheet too much to ask for team using headsets?
No, my team uses headsets.
So with that, you know, Kylie, obviously we all have very similar stuff. You know, Kylie, you know, can you kind of just walk through what is on our exam sheets.
Mhm.
We too love things simple and circled. I was
Yes.
laughing because I was like, we're the same way. But you know, what did you find when we were creating those, having them reflect kind of our optimal pillars, you know, talk about what's on them, and then what do you hear as sometimes struggles when hygienists are being on board?
Yeah. So for ours, it's similar. Ours, we put on our route slips itself. So we chart prep, exam cards, everything's all in one. So the top of the page will have all the patient's personal information, date of birth, family members, outstanding treatment. And the bottom has our exam card. And we literally, you know, it's x-rays today, yes or no. Have you met the doctor, yes or no? Chief complaint. And then it lists out all of our pillars. And then within the pillars, it's truly kind of like Monica had said, it's yes or no. History of ortho, yes or no. Has retainers, yes or no. Are they wearing retainers, yes or no? And kind of walking through that way. Yep, that's it.
I love it. There it is.
And so we just fill that out kind of one, you can, for our recare patients, we can fill a lot of that out in advance when we're chart prepping. And then the rest kind of during our assessment, but it's quick and just right behind us. And we leave ours behind us kind of on the keyboard. And then doctor, when they are getting ready to come in for the exam, they sneak in, grab it, go back to their office to look at x-rays, the exam card, so they have an idea as well what they're walking into. So when we're walking that through with new hygienists, I would say one of the obstacles when you first see it, it's like, whoa, this is a lot of things to discuss with a patient. But having to remind them that it's kind of a flow chart that you work through with the patient throughout their time with us. It's not in one appointment, you need to go through all 6 pillars. It's truly what is the most important and where is that patient right now. So if they're a new patient, soft tissue, hard tissue might be the only thing discussed that day. That's okay. At the bottom, you can just say did not discuss because we're not there yet. We never want to flood them with too much information. So I would say that's one of the first barriers is hygienists think they have to talk about all of that at every visit with every patient. And it's truly just where is that patient at within the pillars and what's the most important at this time.
I think that's so smart because some patients never have gotten probed before. I still keep getting people in my office never gotten probed before. We have to spend 40 minutes explaining what periodontal probing is sometimes, right? And you forget
they haven't made it past there.
Yeah, forget your collapsed airway, Agnes. We got to just right.
Pretty much.
We're not getting there today.
Yeah, we're not going to talk about cosmetics. You got rampant decay and you need SRP. So we'll wait on that.
Yeah, the snaggletooth, we'll fix that later. Let's go. Yeah.
Unless that's our chief complaint.
And then the other obstacle I hear and I see the most is just the confidence in the hygienist talking about certain pillars. So if they're not real confident in implants and know all the ins and outs, or airway or occlusion, or what do we offer for cosmetics? Are they comfortable with all of our whitening systems that we do? Because if I find a lot, they'll kind of stray away from it or go over it really quickly. So then it doesn't seem that important, but that's truly just a lack of confidence that they have. So when we're going through these pillars with the hygienists, truly almost training them a little bit on everything that we offer, what the appointments look like, how long that takes, what doctors do it. So they are comfortable discussing it. And if they're not, making sure doctors aware, they can write that on the route slips, did not discuss, but patient is interested. So then the doctor knows, okay, I need to pick up the slack in this area.
So just to kind of reiterate, so our exam cards, like if you look at that example, they really are just a representation of our optimal pillars. And our optimal pillars, like I said, are soft tissue, hard tissue, occlusion, which means for us ortho of some sort, missing teeth, aesthetics, and airway. And that's because that's the things that we do in our practice. Every practice is going to be different. Monica is going to do different procedures than somebody else someplace else. So pillars are going to be reflective of what are the things that are important to your practice that in your mind are important in the health of a patient that you feel very strongly about talking about. And so our exam sheet is just a representation of that. And I just want to reiterate to Kylie's point, hygienists, we tell them, this is the flow chart. This is the areas that within the lifespan of a patient being in our practice, we want to ensure that we've touched upon all of these because we want our patients to know all the ways that we can get them as close to optimal care as possible. And so to your point, the first struggle is making sure hygienists realize you're not going to do all of this you're going to figure out where do you have to start and where are you going to go to? And it may just be soft tissue, hard tissue, and that's it for that day. So just to reiterate that. And then I want to touch on this topic of, because remember, the whole goal of this is supercharging treatment acceptance. It feels like all we're talking about is hygiene exams, but I want to remind everybody, having incredible orchestrated hygiene exams are what leads to that great treatment acceptance. It leads to better trust. It leads to co-diagnosis with two healthcare professionals that care about the patient. And it's reiterating the importance and urgency. So I just want to remind everybody, that's really what we're actually aiming all of this to. So having a system first and foremost, and then it sounds like with that system, taking the time to train up our hygienists to understand how to use that system right from the get-go is important for everybody, I think we're saying. But what do we realistically expect from hygienists who maybe were in an office, and we've had these, where they came from an office who didn't do any of this.
I was one.
Yeah. They didn't do a lot what was on this sheet. How can we realistically, and this was somebody else's question, I think too, how do we realistically, have expectations for them at 30, 60, 90 days within the confines? For us, it's in a 60-minute appointment for recall, 90 minutes for new patients. And I think, Monica, you're the same, right?
Exactly the same.
Yep. So what are realistic expectations? And I'm actually going to start with you, Kylie, because you obviously train a lot of hygienists.
Yes.
What can we expect from somebody who maybe has some dental experience, has been in an office, but doesn't know a lot of what we're talking about here?
Yeah. So a lot of it will, one, depend, yes, their history and background. And so kind of circling back for us, I'm sure you've discussed in previous podcasts, but like different tier sheets and levels. So truly breaking it up within those tiers. So if they're coming in from an office who've never talked about any of this, you're probably at a tier 1. And so our main focus in tier 1 is going to be that soft tissue, hard tissue, really perfecting it and getting all the ins and outs, knowing how to talk to patients, having good acceptance, including adjunctives, and then working your way into a tier 2, which is then going to start working into some of the other pillars. And what do we need to do, whether it be lunch and learns or after hours or on weekends, to get together to train you up to get to that comfortable level of talking to patients about it.
Yeah. And I think for us, like, our level of expectation in 30, 60 days is really just getting the foundational basic level standard of care, 30, 60 day tier 1 type level hygienist, to where, the standards that have to be maintained. I always joke to like not be sued and keep our licenses. We've got to ensure like that's always the foundational biggest part. And I think it's realistic to expect that, even if they came from a practice that maybe didn't do, notes, didn't take x-rays every time, didn't periodontal probe. That's reasonable.
Those are non-negotiables for us. If that's the bare minimum, you have to have the perio charts with everything, recession and mobility included. You've got to have, the correct x-rays. You have to get IO photos of areas of concern, proper charts. And those are things we audit and then go back through and meet with them. And before we even hire them, though, they know that that's the bare minimum standard and they will be held to that. So it doesn't come to a shock to them when I follow up and go, hey, I was auditing some charts and here's what I'm seeing. They're not surprised that I'm going to come and we're going to make sure you're hitting those standards that we expect.
Yeah.
You touched on something right there too. That's really important. My lead hygienist does the same thing. She audits, right? So we set these expectations a lot of times and we never follow up to make sure they're completed. And then 6 months go by. And then we find that nothing's been done and we have a blow up moment, right? So it's really important to have someone, maybe it's not us as the owner, it's someone just checking in and following up. Hey, I noticed that one didn't get probed this time. What happened there? Did we have enough time? Maybe the patient was 15 minutes late. Okay, that's great to know. It can next time put it in the notes. We know exactly what happened. Okay. So we don't have to wonder. That's just that communication that so rarely happens at the dental office. Right. So those are those things, like having someone to actually go back and look, hey, what happened here? Why couldn't we get that done? Or for whatever reason, figure out the problem and work to solve it right away. Don't assume that the person's doing something just to make you mad, because they're probably not. They probably just don't know. Right. So
exactly.
Yeah.
Well, and do you have anything to add to that, Monica? Of you've gotten obviously hygienists from other offices that don't have the same standards, and that's normal. But do you have a level of expectation similar for 30, 60, 90 days of getting them to a certain level?
I do. I find sometimes it takes longer than that. I find that hygienists that have been practicing much longer at other practices take a lot longer to get them on point. People have come from like maybe newer grads or just haven't practices or haven't practiced hygiene for that long. A lot of times you can get them on the system a lot easier. Also, people that have been temping for a very long time have a very hard time getting on the system. So maybe 90 days is more like 120 days, and that's okay as long as they're showing progress, right?
Right.
So that's what I want to see. I want to see progress. You're not going to take someone who has all these opposite habits and change them to these new habits overnight, right? Without making them feel some sort of way and you driving yourself crazy. So as long as you're seeing progress and you get the bare minimum done, right? And I always link it like you guys did, patient impact, right? Like you say, we don't want to lose our licenses, but like, yeah, we got to do the right thing for this patient. Like, God, like this patient's never been probed. Like, they have diabetes. That's terrible. we really need to take better care of these people. This is why we're doing this. And always impacted back to the patient. This is how we're helping them. But also, oh my God, how much better do you feel about your job that you did the right thing on this person's day? You just didn't send them out the door after a 30-minute cleaning and leave a bunch of calc on their gums. You feel a lot better, right? Yeah, you do. So that's important thing as well. Yeah.
Well, and the thing is let's pretend that hygienist unfortunately doesn't make progress, isn't moving closer towards the standards of care. You don't want to let something fall far through the cracks without auditing it that it's going to end up imploding in your office, but it's going to be in another hygienist chair. And that's the bummer, as I've seen, is if we don't audit the system and know that we're checking to make sure, perio is being diagnosed correctly, we're checking to make sure something wasn't missed, it ends up in a other provider who now has to deal with it.
And then it creates a form of distrust with the patient, because now the patient's hearing conflicting things. My last hygienist said everything looked good, I'm healthy, and they did a prophy, and now you're telling me I need an SRP.
Yeah.
You just want my money.
Yeah.
And so we instantly lost trust of that patient. And now anything we recommend or anything we discuss, they're going to be closed off.
Yeah.
That's right. Yeah. You've turned a proactive patient to someone reactive really quick, right?
Yeah.
And I think that's too within the hygiene department. When you have a really good hygiene department, they'll come to each other. They'll just cut you right out. They'll be like, hey, I found calc on, number 2 mesiolingual. Like come on, like that's the ideal scenario, right? The hygiene department's so locked in that if someone sees someone else or they ask, hey, check my work on this when I had a really hard SRP. I love when I see that super hard SRP. Please double check. Had a really hard time, 90 minutes per quad, double check. Like, okay, great. We all are being humble. We knew this was super hard. It's not getting dumped into someone else's lap. They put your fine scale now in 90 minutes in your column and we can roll. So I think that's important too, that everybody's communicating and everyone just, has a little grace with each other as well. So
yeah. Well, and on that note, so you've created the system, you've got hygienists who are on board. How do the doctors then, because sometimes I've even seen that happens, even a group of great hygienists can come up with a great system and they can all be on board. How do doctors either help support it or potentially accidentally sabotage the efforts?
I would say one of the biggest things is truly utilizing the cards. Sometimes they'll glance at it and go, okay, cool. And then come in and go, so tell me what you talked about, and have no plan, no roadmap, and just kind of start bouncing around from different pillars. And then it gets confusing. And then I'll sometimes get confused and be like, wait, what's the next steps? And then we know it really went off the rails.
Yes. What is the next steps? I love when someone, they get their treatment plan and they're like, wait, what am I supposed to do next? You're like, oh boy, we had a miss on that room, right? So
yeah, exactly. And so I think truly using the exam cards so that you're prepared on what you're walking in on, you have a roadmap, you have an idea of, okay, this is exactly kind of the script that I'm going to walk through this exam on. And while they're going through that, making sure that they are expressing that care and urgency. I think we can get so caught up in day to day that we just we got to go. I'm needed in 3 different places and I don't have time for these 3 exams. Hygienist is amazing. They've already done it all. So I can just come in, say, yep, looks good, and leave. But that patient does need to hear it from the white jacket. And when we're on the same page, they take to it even more when it's like, oh, I totally see what Kylie was saying. I agree. And this is what we need to do and why. Here's my concerns if you don't do anything. This is when I need to see you back by. And just showing the care and taking the time so that patient truly feels valued and it might be their first crown, their first filling. So to them, it's a really big deal. So utilizing that time and then tying that into anything we wrote on the exam card of what the patient values, what, you know, matters to them. If you start hearing that they love to camp and be outside all the time, you know, tying that in with it. I'm really afraid if you let this go, it's going to blow up on you while you're out camping and have no cell service and can't get help.
Yeah. Doctors, I mean, play such a huge part. And I think we can all, I mean, we've talked about this so much that, you know, hygienists can have everything documented beautifully. They can really have these great conversations with patients. And I do think, like, for me, it's the level of doctor preparation too. You know, I'm really fervent on having all of our associates morning huddle prep, just like all the rest of, you know, the team. And I say, like, are you coming to the day just as prepared as they are? And that doesn't mean they need to look through every single exam chart to, you know absolutely everything, but do they have at least an idea starting in the morning huddle of what the flow is going to look like? Are we prepared for the day? And then once again, do they pick up that? For us, we just have it on the keyboard and they can come in anytime after the first 20-minute assessment is done. And you're going to talk about kind of what that looks like in the first 20 minutes here in a second, but they're going to gather all that information in the first 20 minutes, the hygienist, and then anytime after that, our doctors are allowed to come in. But the level of preparation needs to be such that they do look at the card, they do get an idea of what was talked about, and they did, to Monica, your point, like, they've done a quick check of making sure, how long is this going to take? How much time am I going to need to spend here? Versus just kind of going in cold, not looking at anything. And then potentially, and Monica, I love when you said this, they're, you know, beating the horse dead again. Let's talk back through the whole perio thing. Let's talk back through something that our hygienists have already spent a whole bunch of time on. So for me,
and patients' attention span, I don't know about you guys, is getting shorter and shorter, right? Have you noticed that too? I've noticed that it's shrinking, right? So how can we fit all this important stuff in and wrap it up at the end with a bow and still get them in the schedule, but have them understand where their next direction is, right? I think that's super important. So
yeah, doctors have a huge part in this. And I kind of want to move on now to, like, okay, so people are in their heads right now, maybe hearing for the first time, maybe not, have a system, have it documented, which we kind of showed an example, gave our examples. Your hygienist might be all on board, but Kylie, what does that sound like when you see a patient, you have that little exam card, you know, tell us what that looks like. How do you incorporate photos? You know, how do you kind of, what does it kind of sound like? Putting you massively on the spot.
I was like, for new patients or recares?
Let's just start with recares.
Okay. So for new patient or for recares, we get an hour, like we said, which is super helpful because we do have a lot that we want to touch base and make sure the patient understands. And so for recares, we allot anywhere from 15 to 20 minutes for an assessment. Knowing that if they're due for x-rays, we're going to update that. We're going to update the perio chart. We're going to update any IO photos of areas of concern or that we've been monitoring. And then kind of review everything with them and explain what we're finding, any concerns. If there's any of the pillars that we've talked about in the past or we're introducing today, whether it's, you know, we're starting to see their occlusion is of concern. Okay, is that tied in with their airway? We start asking some questions about sleep and then talking to them about their bite and how it all comes together. So that's all wrapped into that initial 15 to 20 minute assessment. And then at that time, we use a Blue Note system throughout our office to let the doctor know the assessment is completed. You can come in at any time now. And so then we'll start our scaling. And the whole goal is for the doctor to interrupt us while we're scaling. Because if there is a treatment plan that's needed, the front office can start working on that treatment plan while we're wrapping up our cleaning and polishing fluoride, all the things. So that way, once we're done, the front office is ready and we can go ahead to that handoff without a lot of lag time or sitting around or waiting for anything.
Yeah. And is there specific verbiage when it comes to talking to a patient, say, about some of those pillars, or their verbiage, and you kind of alluded to this, tying it to what they value or tying it to something big that's coming, you know, up. And we use the same verbiage, Monica, as proactive or reactive. Like, do you tend to like to be more proactive or do you wait to be reactive? Either way, we're here for you. We just love to know which direction do you like to go? Because proactive tends to be less costly, less painful, and easier to fit into your schedule. Reactive tends to be more costly, potentially painful, and it may come at a time that's not conducive to your schedule.
Mhm.
So is there any other verbiage that you use? And then Monica, I'm going to ask the same thing from you, that you have found just tends to be more helpful with patients when it comes to discussing with them the impact that whatever condition is having in their mouth and why it's super important.
So one of my go-tos is when I first show them pictures or a scan or whatever it needs, that I'm trying to show them what issue is at hand or concern that I found. And so as I'm explaining it to them, I always start with, you have a couple options. You can do nothing. Here's my concern with that. Like, you absolutely, they can do nothing, but here's what's going to happen down the road. So they already know the consequences to, oh, well, that's not a priority. I don't have the time. I don't have the money. Okay, that's fine, but here's what's going to happen. Otherwise, the most ideal, proactive treatment would be to, and let's say it's their bite, to realign that bite, get into a healthier balance. That in turn is going to help slow down any cracking, chipping, decrease the amount of recession, protect your bone levels, and just help decrease the aging of your teeth. And so again, it just kind of would depend on exactly what the concern is, what my verbiage. I have tons of them out there. I can have a whole webinar on that. But again, just always letting them know, I think for me is the biggest thing of the consequences to nothing.
Yeah.
So if you want to walk out this door and say, no, I don't want to do anything, or not this time, I'll call back later. Okay, but know what's going to happen. This is what you might be leading into. So I always want to make sure they understand that. And it's not out of fear. I'm truly disclosing to you, be prepared. So then in a month or two, if you come in with a massive, abscess, we told you.
Yeah. We just don't want you to be taken by surprise.
Exactly.
Yeah. I feel like a lot of people are very afraid, especially these days, to tell people what they need, right? And I have a very similar kind of speech. Like someone comes in, they haven't been in the dentist 5, 6, 7, 8, 9, 10 years, right? That person typically needs a lot of work. So I'm going to tell them everything I see in there because they've got 10 years worth of stuff we got to talk about, right? And I always say the same thing. Hey, I see a lot going on. I'm going to just show you what I see. You can do some of it, none of it, all of it. It makes no difference to me whatsoever. I just want you to see what I see today. That way you can make the best decisions for you. Is that okay? Great. Can I put your pictures up on the screen? Yes. Okay. And then we go through the whole entire thing. And then just like you did, I wrap it up at the end with a pretty bow, right? And I always say, the temptation is to I'll do this tooth this year, and then I'll do that tooth next year, and I'll do this one this year. But by the time that has passed, that bacteria in that one little small cavity that we told you about today, we all do that same thing. We brush and floss that small cavity, but we're taking that bacteria and we're smearing it around our whole entire mouth. So the stuff that we just fixed 2 years ago is already under siege from that one area we didn't fix, and we're never done with dental work. So if we kind of get it all set in 6 to 8 months, debacteria your whole entire mouth, you're not going to have appointments like this in the future. Things are going to be cleaned out. You're going to find it much easier checkups. And I have to say that works about only 100% of the time. So, yep. And I think it's not scaring the patient. It's showing them, hey, you have a decision. You can just fix this one, but just know you're never really going to be done. There's always going to be something to fix, or we can fix it all. And we can be really done for a while, and you're going to have these easy cleanings. You're going to be happy walking out the door, and it's not going to be 10 grand every single time you come in. I think that's our job. My core values are actually your guys' core values. I think I actually stole them from your website because I thought they were so good. So we're disciplined and professional. And we talk about that word disciplined and professional, and that's the disciplined and the professional part. We have to be disciplined enough to tell them what we see, and professional enough to deliver in a way that's not scary, but helps them understand it in an impactful, meaningful way, not just feels like a money grab. And it's true. I don't care. It's your teeth. You can do all of it or none of it. It doesn't make any difference to me. But now you know exactly what I know, and hopefully you have no questions about it. We've seen everything together, and it's crystal clear. That's my goal. Yeah.
And I think for hygienists, when we're going through our assessment, sometimes when we see that patient that has, a grocery list of things that are of concern and need to be addressed, it can be very overwhelming. And so it's really easy to just be like, doctor is going to come in and talk about all of it. And it always makes it harder. We're just kind of kicking the can down the road. And so in that instance, for me, when I see that, I kind of, what's the biggest issue at hand? Yes, their occlusion's a mess. Yes, I'm concerned about airway. Yes, they have a missing tooth, but let's take care of the decay first. Soft tissue, hard tissue is always first in line. So of course, soft tissue, that should be something as hygienists we're comfortable and rehearsed in going into. When it comes to hard tissue, if it's kind of all 4 quads need some restorative treatment, I kind of give a broad overview. I'll show them a handful of pictures just to give them an idea of what we're seeing and how bad it really is. I won't walk through every single tooth, but kind
I
of a broad,
agree.
here's what I'm seeing. When, when a filling takes up more than half of the tooth, that's when we have to restore it with a crown because, and then I go into that explanation. If it's less than halfway, we can restore it with a filling. So when doctor comes in, you're going to hear us going through each of these areas and we'll see which ones can be treated with crowns, which one can be treated with fillings, and then we'll prioritize them. What's the most concerning to the least, and we'll just slowly work through each phase as we can until we get you to a healthy position.
Yeah. And I think hygienists too, you guys spend a lot of time explaining stuff, and it's our job to come in, explain it again, but wrap it up in a way. And that makes sense. So I like to do it in a very similar way to you, but a little bit different. I like to show them, like we talked about, good tooth. This is perfect looking tooth. I want everything to look like this. I like to get consensus. Do you see that? Okay, great. And then I like to move on to the next one. I get consensus that this looks different. Now I know that they're paying attention. We've agreed that we like this one looks good. Oh yeah, that one does look different. Okay, here's what's going on with it. There's a crack in this tooth. Okay, just what happens with this cracks in this tooth. We just leave this alone. Just from normal chewing, this crack typically progresses and you go into the nerve of the tooth and we end up needing a root canal. That sucks. Nobody wants that. Or a lot of times it goes down the root of the tooth and we end up taking this whole entire tooth out. And we're doing an $8,000 implant. That really sucks. We don't want to do that. We want to put a crown on that tooth like a helmet to protect it. And then we just kind of, they're protected that way. The tooth won't crack, the crack won't continue, yada, yada, yada. So then the patient already knows, okay, there's the problem. We both agreed that this tooth has a problem. It makes it a lot easier than to lead the patient down to treatment to the road. It's really hard when you put a picture on the screen. A patient's never seen a picture of a tooth before and you go, you see that? And they're like, yeah, it looks like a tooth, right? So I think establishing good and health versus not healthy is always super important. That's part of that education process that we forget a lot of times as doctors. We go, tooth needs a crown. I need you back in 2 weeks for that. It's going to crack otherwise. Yeah, you don't want a root canal. See ya. And we're out, right? But it takes a little front loading to get the patient to understand exactly what's going on in their heads for sure. Yeah.
Yeah. Well, and that leads to honestly kind of the next part, which is like, after that handoff, the hygienist is kind of giving that information. The doctors looked at the exam card. Doctors can really land the plane when it comes to treatment acceptance right here. And so much, if we're training up our hygienists to really utilize those exam cards, they took them, they looked at them, they digested the information, they looked at the chart, they're prepared. These exams, like a lot of times I hear people say, but it just, gosh, I'm in there for 20 minutes all the time, And I say, well, then something's not quite right. Because either you haven't practiced the art of simplifying the exams and coming up with the better analogies, the verbiage. And by the way, Chris Bowman is in DSN. There's some really good resources, podcasts. We've had, a lot of different webinars in regards to what is the verbiage to use with patients that helps to translate things faster. Patients love analogies. We have a whole slew of analogies. Chris Bowman, like I said, I think posted somewhere in DSN, analogies to use in the communications channel. But I think that a lot of times it can go wrong during this exam just because we're not prepared with when we see the crack, what are we going to say? And sometimes we can end up giving way too much information or too little. We can have, to your point, Monica, is we can see everything as a problem to fix. And that's how we approach it with the patient. We can say, I see a crack. We need to crown it. Get you back in 2 weeks. Well, for the patient who's never really been a part of that world, they're not quite even understanding how we got from crack to crown to schedule in 2 weeks. And I think that's where the art of being prepared for walking in and saying, here, to your exact point, here's healthy, but here's what I'm seeing on this tooth. Do you see how that tooth has a crack unlike this one? That's concerning because my worry is I know you're a pilot and you're going to potentially be flying somewhere. You're going to bite on an almond. And I've seen it where those can split completely in half. I would hate that, for that to happen to you while you're on a trip. Because at that point, we're looking at potentially pulling the tooth and doing way bigger treatment. Being able to sit with the patient and spend just a little time, and it doesn't have to take 20 minutes if you've actually practiced this. If you practice with your hygienist, and that's where I'm like, every exam for me was an option to get like a way to get better. Every exam that I would do with my hygienist, I would use those sheets and use them as a way to just keep getting better with my analogies Did I land the plane? Did I come up with consequences? Did I tie their values to what mattered and, you know, the consequences themselves? And I think listening to the patient, because often it was training up my ears and training up the hygienist's ears for what were they saying and not being scared if they said, hey, I'm not sure I want to do this. It should be, great, tell me more about that. Help me understand what's getting in your way. Help me understand what might be holding you back. And being able to be comfortable with that versus, which is going to translate to the treatment coordinators as well, but versus when it comes to the doctor walking in, you need this, walking out, the hygienist kind of saying, you want to get scheduled for that. I think I'll wait. Spending just a little more time to come up with more curiosity, more understanding, more analogies, better verbiage, better consequences,
Yes.
and then having our hygienist be able to spend just that final second of saying, what else can I answer for you?
I
What
always,
wasn't
yeah,
clear?
I always, once the doctor leaves the room, I always start with, do you have any questions about anything them or myself have discussed with you today? And if they say no, I instantly go, okay, so just to recap, and I'll go over it again because some patients don't want to speak up. So I'll still go, okay, so just to recap, we're going to bring you back for those 2 fillings on the upper right, because those are the ones that have the cavities that we showed you. And then that crown on the lower right due to that crack. That appointment should take about 2 hours. Any questions about that? No. Okay, great. Our front office is going to look into your insurance benefits, let you know what to expect at that time. So that way there's no surprises as far as payment goes. And we'll get you scheduled here in the next couple of weeks.
I love that. Kylie is a above and beyond dental hygienist, right? So everybody at home in this webinar sitting at home, my hygienist doesn't do that for me. But I'm going to throw this back on you doctors a little bit. Are you doing this for you? When you leave the room, are you asking, do you have any questions about what we talked about today? Okay. And I do the same thing. I summarize it. Okay. First step, right side, deep cleaning. We're going to get those gums clean out. You're going to come back within 2 weeks. We're going to do the left side. Then we're going to bring you back. We're going to do that crown on the bottom right. We got to get that taken care of. Okay. And then we're going to tackle this upper left-hand side. We have to send to the endodontist for that one. I review it all and give them 1, 2, 3, 4, 5, 6, 7, 8, just like it is in the treatment plan they're about to get from my front desk. If your treatment plan coordinator gets in that room and they're still asking why they need a crown or why they need a root canal or why they need this deep clean, something failed. There was something off. Your treatment plan coordinator, everyone's always like, who closes your cases? I was like, who
knew? Who knew?
Yeah. If you're having someone, they would bring you into bring them into the treatment plan coordinator office and they close the door and they wrestle these patients into treatment. That's not a good way. People are feeling weird about that. They're not feeling happy. They're scheduling and guess what? They're calling back and canceling and never rescheduling again, right?
Or not showing up.
They're not showing up. The only thing they should be talking about is how to make it affordable at that point, right? So Kylie's above and beyond A+ rockstar hygienist. We all maybe get one of these in our whole entire lives, right? So this is, it's true. You know, some of us are lucky we have more than one. We have 2 or 3, right? They're there to help us tee it up. But doctors, if you don't understand how to say it the same way every single time, and you can't get out of an exam in 5 minutes, 10 minutes, then Summer's right. Houston, we have a problem, right? I think that's really super important. As far as goes, she asked to, what's keeping you from the treatment? I like to ask that in the beginning. Hey, you haven't been in 6 years. What keeps you away? Is it time? Is it money? Is it fear? Is it all 3 of those things? I want to know that right off the get. And I'm not afraid to ask them because it's going to help me serve them better. That's all I want to know is how to help them, right? Some people don't like asking that because it feels icky or weird, but I genuinely want to know. Yeah, I'm afraid I've had a bunch of bad experiences. Or no, you know what? I'm just so busy. I have a super intense job. I can only get here when I can get here. Okay, now we know we have to be convenient for your schedule, and we've crossed that barrier, right? Yeah.
Yep. Well, and I think, you know, to kind of wrap it all up, you know, my hope is, I mean, really a lot of this information is important no matter what the economy. But I think right now, you know, to restate it, I think people are even more apprehensive to spend money on things that aren't necessarily necessary. And in the past, when times are good and people don't have to worry about discretionary income, they'll sign up for anything, whatever you say, pretty much.
Right after COVID was a great example. People were saying, more people were coming in and saying, give me 12 veneers, doc, walking off the street than I've ever experienced in my whole entire life. I'm sure you guys were seeing that too. Everybody wanted dental work done right after COVID. It was like we were the hot new commodity, right?
And then
Yeah.
when things start slowing down and they see their friends getting laid off and, you know, things change. And when discretionary income, it's either now, do I want the new iPhone or do I really want to get that crown? I always tell people, like, it's our job to make sure they understand, where do you value oral care on that list? And by the way, I'm not going to be the one to say you have to put it above an iPhone, but I do want you to understand, when it comes to taking care of your health, this is what it's going to look like if you don't. More time, more money, and potentially more pain. And
Yes,
like you said,
anchoring, right?
yeah,
I feel like
right.
that's the word that anchoring is the principle, right? Where you anchoring them to? We don't do this. Higher cost, higher pain, right? More
Yep,
time, right?
more time.
Always anchoring them to something. Yeah.
And so if we can help you get something done sooner than later, this really, if money is your biggest concern right now with this slowdown, or money is what's holding you back, it's never going to get less expensive than right now. And let's figure out a way to have our financial coordinator get you healthy and fit it into your budget. And so if you're struggling right now with your exams, the first thing I would say is, do you have a system? Is everybody aware of the system? Have you actually spent the time practicing that system, how to do that exam with your hygienist? Do you walk in and you've practiced enough what that flow is going to feel like, that you can walk in and not spend 20 minutes, you know, trying to convince people to do treatment? Is there a system? Does everybody know it? Have you practiced it? Is it orchestrated? And then, yeah, your treatment coordinators should be able to just say, let's get you healthy and fit this into your budget. And that's my part of this. If they're running around finding you, asking about how long is this going to take? How many time units? Why are you doing this?
Could they split it up?
Yeah, then we probably just need to start something else proactively within the clinician's appointments instead. But, you know, I think that people will absolutely part with money if they think it's a proactive solution and it's helping for their health and it's preventing long-term consequences. We just got to do a better job in these kind of economies, linking them to that without using scare tactics, I think.
I agree. And it's one of those things too. It's like, well, I'm really scared I'm going to lose my job in a couple of months. I totally hear that. You know, let's just get the filling done right now. I mean, who knows? I mean, it's going to be quadruple if we don't have insurance in a couple of months. It's going to be super easy. We'll have someone give you an estimate for it, right? Those kinds of things. I don't do a lot of Invisalign or even a lot of cosmetic stuff. So this is like truly our bread and butter in my practice, are these people that are coming in. And we have to talk about soft tissue and hard tissue because they're a mess on all those fronts. So that feels good because we're fixing them, right? So I think that it's our duty to show them what's going to happen and why it's so important to do it right now. That's our job just as much as fixing it. And I think we forget about that sometimes, right? Yeah.
And that's where I always joke, like, we spend a lot of times in clinical CE, but we don't spend a lot of time perfecting the exam. And I always joke, I wish I could switch it. I wish we would spend more time perfecting the art of an incredible exam than we would sometimes in the clinical CE, because you're not going to get to do the clinical CE if you can't talk to a patient and link them to the consequences and their own value set. Like,
That's
you
right.
won't even get there.
Yeah.
So Ashley, I'm going to ask, anything from what you've heard that, you know, you were like, oh man, I always get to see you shaking your head, but you get to hear from this stuff all the time with me, but anything you have?
No, I'm just dying because I literally like wrote this down, and then right as you just took the words right out of my mouth. It's like I hear all the time, oh, invest in this clinical CE and this course and this thing. But if you don't have these communication skills and you don't understand what that anchor is that Monica mentioned, and you're not putting you know, Kylie, yes, we know you are a badass and amazing. So, but
She's
if you're
gotten
not
5 job offers in the chat. I saw it already.
Go ahead and
but
Yeah,
if you
move
know,
on.
but if you're not spending that time investing in teaching your team communication and yourself understanding communication, I love all of my dentist clients so much, but communication is not necessarily the strong suit. You know, when you graduate dental school, that's not, you know, top 5 skills that most dental students walk out with. But yeah, that's just such the, I think the core here is just investing in this communication skill and making sure that your team is on board. It's not about selling adjunct services and having the new laser and that type of thing. It's about learning how to communicate and having emotional intelligence with your patient to read the room. Like, where is your patient at? Like, feel out, you know, what they are overwhelmed by. I love that you ask them, Monica, like, why haven't you been here? So anyway, communication is my big takeaway. You literally took the words right out of my mouth in your last sentence. I loved it so
Yeah.
much. That's why I was laughing.
Yeah. Oh, good, good, good. Well, I am grateful for you guys' time. I think we could probably talk forever about this, but my hope is that, by the end of this, I think people are recognizing that our hygiene exams are really just the gateway to everything good in the doctor's schedule. And they're, with every exam, we're setting up either more productive, better days, or we're creating kind of havoc in our offices. And I think that, hopefully with what we discussed, it'll just lead doctors to start to really explore what's going on in the hygiene exams. What are patients saying? And how can we be more proactive, have a system, and calibrate with our hygienists to create better value for the patients in our chairs? So I am grateful for everybody's time. Thank you, ladies, both so very much. An hour just flew right on by.
Sure did.